Good afternoon, everyone. Thank you for joining us today for Financial Strategies for Workers with Disabilities during the COVID-19 pandemic. We're so pleased to have so many of you on the line with us, more than 150 people so far and growing from all over the country. We're just thrilled that you're here with us at the LEAD Center. For those of you who are not yet familiar with us, the LEAD Center, the LEAD WIOA Policy Development Center, is led by Social Policy Research Associates, National Disability Institute, and the Office of Disability Employment Policy. Before we get started, we have just a few housekeeping and captioning tips for you. Today's event is captioned. Use the controls above the captioning stream to adjust font and sizing, and use the scroll arrows to review earlier content should you need to. You also have a chat. Some of you have already been engaging, and we're thrilled to see that. If you have questions during the presentation, please type them into the chat pod below the slides. We will be sure to save time at the end of the webinar for a Q&A session with the speakers. Should you experience any technical support issues or have questions for the technical support team, use the controls in the upper ribbon to raise your hand, and we'll get to you just as quickly as possible. Now, before we introduce our speakers, we want to welcome Patrick Mannix, Chief of Staff, Office of Disability Employment Policy, or ODEP, at the U.S. Department of Labor. Thank you for being with us today, Patrick.
Thank you, Elizabeth, very much. Good afternoon, everyone, and welcome again to this webinar, Financial Strategies for Workers with Disabilities During the COVID-19 Pandemic. As Elizabeth said, my name is Patrick Mannix. I'm the Chief of Staff for the U.S. Department of Labor's Office of Disability Employment Policy, ODEP. I'm also the senior appointee and member of the administration at ODEP, and I would be remiss if I didn't send greetings and best wishes from President Trump and Secretary Scalia. ODEP funds the National Center on Leadership for the Employment and Economic Advancement of People with Disabilities, the LEAD Center, which is sponsoring today's webinar. I worked in financial services for 10 years and have helped many clients with their financial planning. So I'm very happy to be here today talking about this subject. This topic is incredibly important, especially in the midst of this coronavirus crisis. I'm very pleased that ODEP, the U.S. Department of Labor, and the LEAD Center are focusing on financial strategies for workers with disabilities, which is especially relevant, as we said, during this COVID-19 pandemic. The Coronavirus Aid, Relief, and Economic Security Act, or CARES Act, authorized funds to help Americans during these times. This webinar will focus ways those funds can be accessed, how they interact with other federal supports, and how you can use those funds during this difficult time. ODEP and the U.S. Department of Labor understand the sacrifices Americans are making to flatten the curve and help ensure healthy communities. ODEP and its technical assistance centers are regularly posting resources to help individuals and families during the COVID-19 pandemic. And I urge you to check out our website at www.dol.gov/ODEP. Again, www.dol.gov/ODEP. to learn more. In addition to focusing on COVID-19, we are also working on a series of events and resources to commemorate the 30th anniversary of the Americans with Disabilities Act, or ADA, which was signed into law in July of 1990. The ADA is a civil rights law that prohibits discrimination against individuals with disabilities in all areas of public life, including jobs, schools, transportation, and all public and private places that are open to the general public. The purpose of the law is to make sure that people with disabilities have the same rights and opportunities as everyone else. And now, more than ever, this is especially important. We invite you to learn more about the ADA during this important year. With that, I'll turn it back over to Elizabeth Jennings, the Acting Executive Director of the National Disability Institute. Elizabeth is a colleague and will be moderating our webinar speakers to tell us more about the CARES Act and financial strategies for workers with disabilities during this COVID-19 pandemic. Thank you. And Elizabeth.
Thank you so much, Patrick. It's our pleasure to have you here with us, and we greatly appreciate the comments that you shared. As Patrick mentioned, it's the 30th anniversary of the ADA, and while we are pretty overwhelmed right now with things going on around COVID-19, we don't want to forget that one of the promises of the ADA is economic self-sufficiency for people with disabilities. So as you get different resources and tips today, we'll hope you'll apply them during this very tumultuous time in history, but that you'll also consider what they can do for you and for other people with disabilities as we move towards a more promising tomorrow. We're going to go over our webinar objectives. Today, we hope that you will gain resources to support financial resiliency, both now and moving forward, understand how stimulus payments affect public benefits, and learn tips to reduce spending and save money. We are so pleased to have a great array of speakers for you. As Patrick mentioned, I'm your moderator today. My name is Elizabeth Jennings, and I'm the Acting Executive Director of National Disability Institute. We also have with us Linda Mastandria, Director of the Office of Disability Integration and Coordination with FEMA, Nancy Buteau, Manager of Financial Empowerment with National Disability Institute, and Mario Gutierrez, Director of Financial Counseling Division with the New York Legal Assistance Group. Given the incredible information we have to share with you, we're going to jump right in and introduce Linda to share us with information from FEMA. Thank you, Linda, so much for being with us today.
Good afternoon, and it's my pleasure. Thank you so much for having me here today to share some thoughts with you. As you heard, I am the Director of FEMA's Office of Disability Integration and Coordination, and we work across FEMA and with our state, local, territorial, and tribal partners, as well as NGOs and the private sector, to ensure that the needs of people with disabilities are met before, during, and after disasters. And today, I'm going to set the stage talking broadly about financial preparedness for people with disabilities during disasters, including things like the COVID-19 pandemic. Next slide, please. So, an overview. Today, we're going to talk about three things. First, that disasters can happen at any time. Second, that it's important to prepare. And third, we're going to talk about the Emergency Financial First Aid Kit. I'm going to tell you what that is and how to use it. And finally, we'll share a few resources with you to help you on your journey to becoming financially prepared for disasters. Next slide, please. So now we're going to talk about how disasters can happen at any time. Next slide, please. When it comes to emergencies, as a nation, we face it all, right? There's hurricanes, earthquakes, floods, tornadoes, fires, and public health emergencies like COVID-19. At FEMA, we're currently responding to 71 major disaster declarations and 87 emergency declarations around the nation. And we've seen a significant uptick in the number of disasters over the last several decades, from an average of 23 major disaster declarations a year in the 1980s to over 61 major disaster declarations a year in the 2010s. And the hurricanes are more powerful. The fires are more deadly. And we all know we've never experienced anything like the current COVID pandemic in our lifetime. So what can we do about this? And I know many of us would really rather just pull the covers over our head and say, wake me when it's over. And I get it, I really do. But there is an alternative. Next slide, please. Let's talk now about why it's important to prepare. Next slide, please. So we hear this word a lot, right? Prepare. Be prepared. We need to be prepared. So what exactly does that mean? What are we preparing for? How do we do it? Let's talk about that. So, when you're going for a job interview, what do? You prepare, you get ready. When you want to run a marathon, you don't just show up, you prepare. You think about what you need to do to achieve that goal, and you create a plan to get there. And preparing for disaster is no different. The goal may not be to cross a finish line in under 4 hours. Instead, it may be to ensure that your family stays alive, stays healthy, and that your home is livable and in good condition. So let's talk about how you can achieve those goals. There's a lot of simple steps you can take to get you and your family prepared for disasters. And it starts with simply sitting down with your family. Get everyone together. Talk about the kinds of disasters you face. Are you in a flood zone? Are you prone to hurricanes, tornadoes, fires? Knowing what kind of disasters you face where you live is going to help you better prepare. Public health emergencies like COVID-19 require a slightly different plan. We're not worried about the house blowing down. Right now, we're worried about how long we have to stay inside it. So let's start there. What do you and your family need to stay inside for a few weeks or a few months? What do you have on hand? And what do you still need? From there, you start to build out your go kits and your shelter-in-place supplies. And now for COVID-19, since we're really sheltering in place, we're not evacuating to somewhere else, let's focus on that. So what do you need to stay home for a month? You need food, right? But do you stockpile it, or can you take advantage of delivery services or local restaurant delivery? You can really do some of both. For example, I have lots of cans of soup and beans and tuna and peanut butter and frozen vegetables and bread and bagels. So I can put together a pretty nutritious meal pretty easily if I have to. You're going to need toiletries, your soap and your shampoo and your razors and your paper products like toilet paper, cleaning supplies, sanitizing wipes. And what about if you have pets or service animals? You need to think about them as well. Now, I know it can be expensive if you're talking about building this big stockpile of things all at one time. So ideally, you're going to buy a little bit at a time and add it to your supplies. And right now, because many online delivery services are taking days instead of hours, we need to think a little further out. We can't call Instacart and say, I want something in 2 hours. It may be a few days. And there may be stores that are offering online ordering or curbside pickup, and those may be alternatives for folks who have transportation and a way to get there. So in addition to building this shelter-in-place kit, you're going to develop a communication plan. And while this may be more applicable for a natural disaster where the kids are at school and you're at work and you need to find a way to communicate and get back together, this is still a great time to discuss how you'll handle that situation. And additionally, it's really important to listen to your local officials, to sign up for text or email alerts to get the latest information on emergency and public health alerts from your local jurisdiction. And finally, it's really important that you develop what we call the Emergency Financial First Aid Kit, or FFAC for short, and we'll get more into that in a moment. But I want to first tell you about a couple things not to do. First of all, you don't have to panic. Thoughtful preparation is the key to making your way through COVID-19 or any disaster, and you don't need to hoard. Groceries and store shelves are being restocked regularly, and there will be enough for all of us. Buy just what you need for you and your family. Next slide, please. So let's now talk about the Emergency Financial First Aid Kit, or FFAC. Next slide, please. What exactly is an Emergency Financial First Aid Kit? And why is it important? Well, it's a toolkit. It was developed by FEMA together with an organization called Operation Hope that helps individuals and families collect and organize critical financial, medical, and household information. It contains forms and checklists that you'll need in an easy-to-follow and fill-out format that helps you create a centralized record of essential information for you and your family. And this is really important because we all need to have a financial plan to face whatever emergencies come our way. And they don't have to be big, like a hurricane or COVID-19. It could be an unexpected car breakdown or your dog getting sick and needing to go to the vet. Making sure we have a plan and we're ready to face whatever comes our way is what the Emergency Financial First Aid Kit is for. It gives you everything you need to consider in an easy-to-follow set of forms and checklists that you can tailor to your individual family situation. There's 4 categories of information you'll gather to prepare your FAQ. First, household identification. This is information on all of your household members, like your birth certificates, passports, driver's licenses, marriage records, divorce and custody records, employer records, school and emergency contacts. Your financial and legal documentation. This is no surprise, right? Your bank statements, your pay stubs, your SSI, your SSDI, and other benefits and income statements. Your tax records, mortgage or lease information, insurance documents, wills, trusts, powers of attorney. Next is your medical information. This is your medical history, your illnesses, your injuries, your surgeries, information on your disability, medications you take, your physician, therapist, and treating professional information, your living wills or advance directives. And while those are legal documents as well, you'll keep those as part of your medical information because you're going to want to share those with your healthcare providers. And finally, you're going to gather information on your household contacts. And this is where you're going to store all of your important contact information like your banker, your insurance agent, your disability service providers, your DME providers, your lawyer, your church or spiritual advisor, your accountant or tax professionals, financial advisors, and healthcare providers. And don't forget your pets and your service animals. You'll want their veterinarian information as well as your pet sitters, your walkers, or anyone else that provides care or service to your animals. It does sound like a lot to think about, right? But we've taken the guesswork out of it by giving you all of the tools you need to prepare your plan. Next slide, please. So how do I prepare my emergency financial first aid kit or FAQ? First, you're going to want to set aside a little bit of a block of time or several blocks of time over several days to get this done. I'm not going to lie to you. It will take some time, but it is absolutely worth it. Once you have it done, you'll only have to update it once in a while. So where do you begin? You head over to ready.gov/financial preparedness, where you can download your kit right there to your computer or tablet. And right in front of you, you'll have all of the fillable forms and checklists you need. And there's really 4 basic steps to this process. First, you'll assess and you'll compile. You'll gather your important documents, your papers, your personal, legal, financial, and medical documents, all of the things we just talked about. You'll follow along with the forms and checklists, and you'll keep copies of all your important documents together with your FAQ as you go along. Next, you're going to want to review. Make sure your insurance policies and accounts are accurate and up to date, and that there's nothing that needs to be corrected or changed. Third, you're going to want to safeguard these documents and your FAQ. It doesn't help you at all to do all of this work if everything burns in a fire or floats down the street in a flood. You want to invest in a fire and waterproof box to store everything in, or get a safe deposit box at your bank. Or, even better, scan and keep a password-protected copy on your computer. Share that password with your trusted contacts. And you might want to consider giving a copy to your lawyer or financial advisor for safekeeping as well. And finally, you're going to want to update this document periodically. You should review it at least once a year to make sure that everything is current and up to date. But you're going to want to update it more frequently if you have any major life changes, for example, a new job, if you get married or divorced, if you have a death in the family, a new baby, or if you move. That's really all there is to it. And, you know, we owe it to ourselves and to our families to prepare our FAQ so that we have all of the information we need at hand to prepare for and recover from disasters. Next slide, please. So now just a few helpful resources for you. At FEMA, we have a useful page on the latest coronavirus information at fema.gov/coronavirus. And here you can get some of the latest information on information, resources, what's happening at the state and local level and across the government, as well as rumor control and best practices. At ready.gov, there's great information and checklists on important preparedness activities you and your family can take and engage in to get ready for any emergency or disaster. At ready.gov/financial preparedness, that is again where you'll find and download your emergency financial first aid. And finally, at ready.gov/disability, there's a lot of preparedness information there that's especially useful and relevant for people with disabilities and their families. Next slide, please. So thank you so much for your time and attention today. I am grateful to have had the opportunity to share some tips with you on how to financially prepare for COVID or any other disaster. I've provided my contact information as well, which is linda.mistandria@fema.dhs.gov, and you can contact me at any time. Thank you so much for your time and attention today. Now I'll turn it back to Elizabeth.
Thank you so much, Linda. Thank you for the tips. I think you said it right when you explained that these are simple steps that we can take. I know that I'm going to be downloading my kit so that I can start my practice of getting my EFIC kit ready to go. Thank you again. And next we have with us Nancy Buteau from National Disability Institute.
Thanks so much, Elizabeth. Hi, everyone. I'm so happy to be able to join you today, and I hope everybody is staying safe and healthy and managing these difficult times as best we all can. I'm really happy today to be here to talk to you about COVID-19 and how that relates to individuals who are on public benefits. So I want to start off by talking about something really important, which is if you are a beneficiary, if you know a beneficiary who has lost their job or who has been furloughed, it is really important that that person reports their loss of job to the Social Security Administration immediately. And that can be done several ways. A person can call their local office. Sometimes the local office number is difficult to find, in which case they can call the 1-800 number, 800-772-1213, or the person can also go on to myssa.gov and go into their MySSA account, or if they haven't opened an account yet, actually start their own MySSA account, which I think would be a great idea for everybody to do. I personally have one myself. And the reason that this is important is the only way that the Social Security Administration will know if a beneficiary either starts working or stops working is if the person reports it. Otherwise, the Social Security Administration will not know. So having said that, I'm just going to repeat the same things again, which is once a person returns to work, same thing. Must report that to the Social Security Administration, either via the local office, the 1-800 number, or on their MySSA account. So this next slide, I apologize, it's a little wordy. I'm going to read it because it's official language from Title 26 of the Internal Revenue Service Code 6409. And it says, notwithstanding any other provision of law, any refund or advance payment with respect to a refundable credit made to an individual under this title shall not be taken into account as income and shall not be taken into account as resources for a period of 12 months from receipt for purposes of determining the eligibility of such individual or any other individual for benefits or assistance or the amount or extent of benefits or assistance under any federal program or under any state or local program financed in whole or in part by federal funds. So what does that mean? Well, it's good news. So let's talk about why that's good news. It's good news because what that means is the stimulus payment has no impact on a person's benefits. And we're going to get more into specifics about what those benefits are. The stimulus payment is also not taxable, and it does not count as income. So very good news there. And let me go on to my next slide. Sorry, there we go. So the stimulus payment has no impact on the following benefits: SSI, Supplemental Security Income; SSDI, Social Security Disability Insurance; disabled widow or widower benefits; childhood disability benefits; Social Security retirement; Supplemental Nutrition Assistance Program, SNAP; temporary assistance for needy families, TANF; housing and urban development rent subsidies, as well as Medicaid and Medicare. And we're going to get into those in a little more detail. So first, let's talk a little bit about SSI, Supplemental Security Income. As I mentioned before, the stimulus check is not taxable. Also, the payment received by the individual from the CARES Act will not count as income when Social Security is calculating that person's SSI amount for that month. And that's really important since many of you know that the SSI program is a needs-based program, and both income and resources are taken into consideration when looking at that SSI check and how much somebody will be getting. And then also, the stimulus payment will not be counted as a resource for 12 months. So that's a great amount of time. For those of you that are familiar with the Earned Income Tax Credit, that, last 12 months, same with the stimulus payment. A person can keep it in their bank account for up to 12 months, and it will not count as a resource, so a person doesn't have to worry about that affecting their SSI eligibility. Let's move on to Social Security Disability Insurance, SSDI. So the stimulus payment will have no impact on the following Title II benefits. So we mentioned these before. I just wanted to point out that these are all considered Title II benefits: Social Security Disability Insurance, disabled widower benefits, childhood disability benefits, and retirement. And the reason that these programs aren't affected is because they're considered insurance. We paid into those through our paychecks. So most of us see our FICA and that it goes away when we get paid. The reason that that happens is because we are paying into our insurance. So one day in the future when we retire, or perhaps if we become disabled, we will get that money back. So similar to SSI also, the stimulus payments will not be taxable under SSDI as well. So just to be clear, not taxable under SSI, not taxable under SSDI. So we're going to also talk about Medicaid and Medicare. I'm going to start with Medicaid. So in all states, Medicaid recipients who received benefits before the COVID-19 crisis, or perhaps became eligible during the crisis, those cannot be terminated. Those benefits by law cannot be terminated. Now, on a case-by-case basis, what states are able to do is possibly change that category or eligibility. So a person can go from regular Medicaid to what we call 1619B. 1619B is continued Medicaid for individuals who are earning too much money to qualify for the state's regular Medicaid program. A person may also get switched to Medicaid buy-in for working people with disabilities. But again, terminations of coverage will not be allowed. So if somebody gets a letter that says that their Medicaid is changing, that doesn't mean go into a panic. As Linda said, stay calm. Read the letter thoroughly, because it's not that you would be getting terminated, it's that your coverage may be changing. When talking about Medicare, the stimulus payments also have no impact on the Medicare premiums or eligibility for Medicare. And then for people who are enrolled in Medicare savings plans, which are programs where you also see Medicaid possibly paying for some of the Medicare premiums for Part B, possibly for Part D, those will stay the same as well. So if somebody is receiving Medicaid to pay for some of those premiums will still be covered under Medicaid. Some other public benefits programs, we talked about this a little bit before. Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps. The stimulus payment will not affect that, will not affect TANF, Temporary Assistance for Needy Families, will not affect that eligibility or resource levels for 12 months from the time they get those funds. And as we mentioned before, HUD, Housing and Urban Development, rent subsidies will not change due to somebody being able to receive that payment. I want to talk briefly about unemployment insurance for individuals who are on SSI. So as we talked about before, SSI is a needs-based program. And because of that, people who are on SSI are required to apply for other public benefits that they may be eligible for. So in this case, that means if a person has lost their job, they are pretty much required to apply for unemployment insurance. So typically what will happen is the Social Security Administration will advise the beneficiary on a written dated notice of potential eligibility for other benefits. And I just want to stop here for a second and say that on a written dated notice is so important. The Social Security office is not going to call you and say, oh, you need to apply for other types of benefits. If somebody's calling you saying they're from the Social Security Administration, it's most likely a scam. So be really careful about that. Whether you get a written notice or not, it's a great idea for people to apply for unemployment insurance if they're eligible. And I'll talk about that in a little bit. So the second bullet there, the beneficiary must take all steps necessary to file for, if they're eligible, and obtain any payments within 30 days of receipt of that notice. So what that means is if Social Security sends you a letter, they expect you to apply for other benefits that you might be eligible for within 30 days. If a person meets their state's unemployment insurance base period, and basically that kind of means that the person's worked long enough and has earned enough, although that's being waived pretty much statewide, so almost anybody can qualify for unemployment insurance if they were working and were released because of the pandemic. The good news about that is a person can receive much more through the unemployment insurance program than they could through the SSI program. We know that the SSI program doesn't cover a lot of what a person needs. It's a simple supplement. However, unemployment insurance can last up to 43 months, and a person might actually be able to earn much more or receive much more financially than if they were to just be on SSI alone. So we encourage people to apply if they think that they're eligible, or even if you're not eligible, it can't hurt to apply and see if you are eligible. And a great way to find out if you're eligible for, we're going to talk about unemployment, but right now what I want to say is some people might be interested to know whether they even are eligible for the economic impact stimulus payment. So you can go to this website, which is www.irs.gov/coronavirus/economic-impact-payment-information-center. So you can go there, find out if you're eligible for a stimulus payment, and then the resources here that I want to talk to you about, Social Security Administration, you can actually go to ssa.gov and sign up for specific information regarding coronavirus. So you can get on that listserv and they'll be sending you information about that. What I was just mentioning about unemployment insurance by state, you can go to this careeronestop.org website and actually find out in your state if you do qualify for unemployment insurance or not. The next resource was the same one on the page before, the place where you can go and see if you qualify for the stimulus. And then even though we did not talk about ABLE accounts, I just want to mention this because for people who are qualified for an ABLE account, Achieving a Better Life Experience account, the stimulus is a great place to be able to put that check and save it for any length of time. So we talked about how the stimulus check won't affect somebody's SSI eligibility for up to 12 months. However, if somebody wanted to save that stimulus check and continue saving for other things, they could do it through an ABLE account. So the ABLE National Resource Center website is there for you. And then lastly, some of the things that we talked about in terms of benefits, Medicaid, Medicare, all of that is from Cornell University. So we've got their website listed there as well because they've got some wonderful information regarding coronavirus. So having said that, I thank you again for your time, and Elizabeth, I will turn it back over to you.
Thank you so much, Nancy. A lot of incredible information. I know several of you had questions coming into the chat box during Nancy's presentation. Some she answered just as you were typing them in. Others we put into the our own question box to ask Nancy as we get to towards the end of the webinar. Thank you again, Nancy. I now want to welcome Mario Gutierrez, who's with New York Legal Assistance Group. Thank you so much, Mario, for being with us today.
And thank you, Elizabeth, for having me, and for everyone else on the call. Just wanted to send positive energy out to you all, certainly during these trying times. So again, Mario Gutierrez is my name. I'm the director of the Financial Counseling Division. I run a team of about 12 financial counselors and coaches who reach about 5,000 clients annually. For the last year and a half, we've been engaged with the City of New York and the National Disability Institute on a special project called Empowered NYC, which had the goal of tailoring financial counseling for people with disabilities. So again, really happy to be on this call. So that's me. About my organization, New York Legal Assistance Group, or NYLAG. We are a legal services nonprofit that also provides financial counseling and engages in policy advocacy efforts. Since we are a law firm, I should say we have a disclaimer here that the information I provide is intended just for educational and general information purposes and is not official legal or tax advice. As for the agenda, it's quite simple. I want to take a few minutes to talk about what clients can do immediately after the event, in this case, COVID-19, but in general. Wanted to highlight some additional resources beyond the many resources that Nancy just presented on. Round that off with things to watch out for. This is really fraud and scams. And then finally, just wanted to quickly introduce some of the concepts or some of the practices of financial counseling and coaching, especially working with people with disabilities. So in day one, now I should make it clear that I am working from the premise that employment, earned income, business income has ceased at this point. So that's kind of the vantage point that I'm coming from. So these are the things that one should consider doing, preferably beforehand, but obviously do so once they've lost that income. So first and foremost, prioritize those bills and expenses. Whether it's with a financial counselor or not, you need to take a moment to review your bills and identify which ones are crucial and which ones may not need to be paid immediately. There certainly are general rules to what's critical or not, but this is really a case-by-case decision that has to be made by the person with their financial counselor. Now, part of that determination is now a bit more fluid, with the assistance being offered by the CARES Act, with local legislative and rule changes, and private actors stepping up to face the crisis. Things are not so straightforward. For example, with credit cards, many issuers are offering some kind of debt relief, like deferred payments and waived fees. As for your credit report, as stipulated by the CARES Act, if you're receiving some assistance from your creditor, an account that had been current positive previously will continue to be reported positively for both account status and payment history. So I share all of that because in determining if the bill needs to be paid right now at this moment, it certainly makes sense to consider deferring payments in some cases for some more critical obligations that our clients may have. These are the kind of conversations that counselors are having on a daily basis with clients. And I just want to stress again, there is no silver bullet. There's no right answer, frankly. It's not so straightforward. Same thing with student loans. Payments for federal student loans, as many of you may know, has automatically stopped from March 13th to September 30th. Now, I should stress these are federal student loans, not private student loans. Interest has been temporarily set at 0%. Now, these aren't all federal student loans. There are some that are not included in this relief package, like FFEL loans that are owned by banks and some Perkins loans. So again, this is just something else to kind of keep in mind when we're talking to our clients and beginning to prioritize these expenses and obligations. I should say for private loan holders, it is certainly, there's less help that's out there. You will have to check in with your servicer to see if they're providing any relief. I will say here in New York on April 7th, the governor of New York announced an agreement with the largest private student loan servicers in New York to obtain relief, and this is the relief for private student loan borrowers. So it's happening on the state level, and something that our clients should check in with their servicers to find out if that's something that they can get some help with. And then finally, with rent and mortgage payments, this is just another example of how this pandemic has flipped some of the traditional advice. Typically, rent was the most critical bill to be paid in most cases, and I'll argue that it probably still is. But available relief programs have made this decision a bit more nuanced now. So for rent, for example, many jurisdictions, or rather most jurisdictions, have not suspended or forgiven rent. New York City, for example, has issued an eviction moratorium, which prevents evictions for non-payments for the near future. But without forgiveness, accrued rent payments, along with fees, will likely be owed at some point. So again, not so straightforward. Skipping rent at this time might be something our clients may need to do in order to keep food on the table, but it doesn't come without risks. I should add that some of the clients that we're working with, their landlords are canceling rent on their own, which is great, which is obviously a huge help. So it certainly is worth checking in with one's landlord. Just want to take a moment to discuss mortgages before we move on. Foreclosures and evictions have been halted until May 17th. Who knows if this will be pushed back? I should say that this order only applies to mortgages that are owned by HUD, Fannie Mae, or Freddie Mac. Again, beyond that, it's a matter of checking in with your servicers to see if they're able to provide any relief during this time. So just to round out this point, the takeaway here is that when we're helping our clients, we need to realize that not all bills and obligations, that the expectation for all these bills and obligations, we shouldn't take that for granted. We should check in with services, with products, with anything that we're paying, and check in with them to see if there's any hardship program being offered at this time. So the next thing after the incident, if you will, the day one immediate steps that one should take is to reduce non-essential expenses. This is always a complicated and maybe sensitive thing to discuss with clients, again, because there's just what's non-essential for one person may be very essential for the others. I will say that if I did not have internet connection here in my home, my children will probably, riot against that. But so it's not as easy as saying, hey, cut off the internet, no more music streaming services or what have you. We do want to approach that conversation with some sensitivity. So it certainly is worth listing out all expenses and really beginning to see which ones would be able to be cut. But I just want to I think you all know, but I just want to make sure that we're not approaching this conversation too heavy-handedly. Identify personal resources. What I mean by this is that especially if social distancing lasts any longer and we start heading into a deeper downturn in the economy, people with larger network of support will likely fare better. Family members, friends, associations, all of these things will come in handy if our clients are hitting a rough stretch. It's not only for one's own material support, because studies show as well that there's a positive impact when people help other people. So it's also a matter of encouraging our clients to really, foster these relationships and don't be shy to reach out and ask for help if need be. And then this final point on this slide is that we really should be helping our clients with forecasting what's going to happen in the near future. This is a bit of an intimidating exercise, but it's really important that we start jotting down what things might look like down the road, because this will provide insight on what additional steps we may need to take and give us more time to plan further into the future. Now, for the remainder of my slides, and because I want to be conscious of time, I'm just going to go through these a bit more quickly. Besides the resources that Nancy mentioned moments ago, resources that we're encouraging our clients to identify, research, and reach out to are food pantries, soup kitchens. Even if they are in the case right now, even if they're not in need of it, it's important to start identifying these resources in the event things get a bit worse. I will say that many cities and localities are leading the way with additional food support, so it's probably something we should encourage our clients to keep an eye out, maybe keep in touch with the local human services agency that is out there. For small business, part of the CARES Act, and I should say a lot of the clients that we see, at least here in New York, are sole proprietors. The CARES Act did provide a lot of support for small businesses. I think many of us know, unfortunately, that the main source of this support, the loan and the advance, is no longer available. So, but small business owners and sole proprietors could still check in with the SBA website. There's tons of SCORE counselors that are out there that may be able to provide some additional advice and support. Some of our clients have professions that have special resources. So, for example, as you can imagine, here in New York, there are a lot of bartenders, and there's actually a special grant that's being offered by a local foundation for people in that profession. So when working with our clients, we may also want to encourage them to do research or do research for them to see if there's any of these special grants that are available. Finally, there are free loans that nonprofits are providing. These are free loans, meaning that there's no fee to take out the loan, and there's no interest that's tacked on top of it. In New York City, one example is the Hebrew Free Loan Society, where they're providing a loan for those affected by COVID-19. So I did want to just take a moment to talk about fraud and scams. And I believe Linda spoke about this earlier, but $13 million has been lost to fraud and scams since January 1st. And a lot of these are connected with COVID-19. This ranges from text messages from the quote-unquote government trying to confirm banking information for the stimulus check. We also are seeing online offers for vaccinations and home test kits, and also, sadly, fraudulent requests for donations for fake charities. So it's really important that we really stay extra vigilant during these times. We should instruct our clients, if anyone is trying to reach out to you requesting confidential information, just hang up and report them to the Federal Trade Commission or the FTC. So here, my final slide, I just wanted to take a moment to just highlight some of the things financial counselors and coaches were doing pre-COVID-19. Nothing bars us from continuing to have these conversations now, but obviously everything is really centered on kind of the impact of COVID-19. But prior to that, our counselors were on a daily basis working with clients to really spell out the benefits of adding income to their benefits. Certainly talking about the impact that earned income can have on their benefits. Besides that, also really encouraging clients to continue to report their income to SSA. These are some of the topics we were really focused on, prior to the pandemic. Nancy mentioned moments ago about the ABLE account. This is certainly a powerful vehicle for our clients, and it's something that we certainly focused on a lot and continue to do so during these times. And then the more traditional financial counseling topics like budgeting, credit, debt, and long-term planning. So with that said, these resources will be provided. Actually, the top resource, my organization, NILAG, has a page committed or dedicated to coronavirus and listing out all the resources that are available. So that's something to keep in mind. All of the other resources are listed on that website, so you will be able to see that there. And I think that brings me to my end. So thank you so much.
Thank you so much, Mario. This was an incredible amount of information, and I really appreciate that you kind of gave us, much like Linda, some very simple guidance. What can you do at day one, and how helpful that was. So thank you very much. Many of you gave us questions. We have just 5 minutes, so I'm going to try to go through what I think were some of the most important ones, or the ones that came through most frequently. Just as a reminder to all of you, all of the links, the resources, everything that was shared with you today will be available on the LEAD Center. It's www.leadcenter.org. Nancy, let's jump to you really quickly. Several people asked, what happens if my stimulus check puts me over the SSI $2,000 limit?
Great question. So it doesn't matter, which is fantastic. So remember that funds will not count as income, and then for a full 12 months, starting the day that they get it, that money will not count as a resource either. So the asset limit does not matter. for the stimulus funds.
Great, thank you. Linda, one to you. Folks asked, does FEMA offer any kind of emergency preparedness training?
Thanks for the question. Yeah, so FEMA offers lots of training, both as an agency and through our partners at the Emergency Management Institute and the Center for Domestic Preparedness in Maryland and in Alabama. But we offer trainings throughout the years through our state and local partners with non-governmental organizations, with state emergency managers, so you can be trained on everything from how to write a good emergency operations plan to how to be better prepared, you know, as an individual and family. The Office of Disability Integration and Coordination in particular does a lot of work through our regional disability integration specialists. There's 10 of them around the country, and they do a lot of this stakeholder engagement and outreach specific to disability issues and preparedness.
Oh, that's incredible, Linda. Thank you so much. I'm going to make sure I find the person in my region after this call. Mario, a few people asked, you know, things in household might be fine right now, or maybe we're a group of people living together. What happens when the income of one of the people in the household changes? What are some things that we should do to counter that? So we're fine right now, but we're not sure what could be coming.
Yeah, no, this is always a challenge, and I think it kind of boils back to, it goes back to the point of that Linda was making in terms of being prepared. You know, having that conversation now, if possible, contributing collectively to some sort of group emergency fund, if you will. For example, with a lot of the clients that we work with, particularly couples, we always encourage that they put just a little bit more when they contribute towards the rent or collective bills. Just put a little bit more than what's expected so that you can just slowly but surely build out that emergency fund in the event that happens. But again, it's a difficult situation. You know, the positive is that they have a group of people that are living together, so hopefully they can all you know, get together, you know, combine their resources and make it through with minimal harm.
Yeah, thank you, Maria. That's a good reminder that some of what we got today is also to immediately respond to the crisis situation, but also to prepare for the future. So back to you, Linda. Can you help us understand the EFIC that you mentioned, the Emergency Financial Assistance Kit? When I go through that kit, are there things in there for me that will address some specific disability needs?
That's a great question, yeah. So the Emergency Financial First Aid Kit is meant for all kinds of families with all kinds of situations. It's not a disability-specific document, but there are questions that will lead you to fill in disability-specific information, such as about disability-related needs, healthcare-related needs, healthcare providers, different things like that, medications, specific reference to service animals and the like, things like that, as well as referencing durable medical equipment providers and things like that. So there's lots of prompts throughout the document that will reference disability-specific information and give you the clues about kind of the things that you need to be thinking about to answer these particular pieces of the plan.
Thank you so much. I think we have time for just one more. We're going to give it to you, Nancy. Can you help us understand, if I receive SSI and I'm required to apply for unemployment insurance, what happens to my SSI cash and health care benefits?
Oh, that's such a great question. Sure. So SSI recipients, the SSI check will be suspended. Now, that sounds like a scary word. It's not. It just means that a person is in suspended mode, not terminated, just suspended. So it puts their SSI check on hold, and their Medicaid continues as it normally would. So really, a person on unemployment can do better than when they were receiving SSI.
Incredible. Thank you again to each of our speakers. You just provided us with so much information for us to consider today and to also help us prepare as we move forward into what is the 30th anniversary of the ADA, so a good time to be able to think about what's happening now but look forward to better days. I hope you can join us again next week, April 29th, from 3 p.m. Eastern to 4 p.m. Eastern, 12 to 1 Pacific for those of you on the West Coast. Our topic will be how WIOA can support workers facing economic challenges. On this webinar, you'll hear from workforce professionals who are using financial literacy education activities within their job centers to support job seekers with disabilities.